Okay, hello, my name is Guadalupe.
And my name is Mara, and we are your Nutrition and Wellness Practicum. Today we are doing a presentation in Founders Woods, which is a nice apartment complex located outside of Benedictine University. And we are talking about
something that everyone here loves. I know I love them, and I know everyone here does.
But we don't love what it causes this disease.
We are talking about breast, and specifically breast cancer. So big or small, save them all, right? So you start off with risk factors of breast cancer. And one of the biggest things is when you give birth to the age that you're giving birth. The higher an age that you get is the more risks that you're going to end up happening. So let's say women that do give birth around like 35 or so, then that's when they're going to start getting higher risk for breast cancer. And weight plays a big major risk factor. I'm going to take that away.
Another big risk that we have here is genetic risk. And this is the time where we need to ask the audience if they have experienced breast cancer themselves. I personally have in my family, you know, not directly, but through aunts and, you know, other people's grandparents. My mom's closest friends, she's in her mid-40s right now, and, you know, they are, I don't want to say flying like flies, but a lot of them, I'd say 3 out of her 5 really good friends have had breast cancer. So it's really hard right now. So have you been touched by it? Have any of you?
My grandmother has.
Oh, your grandmother, is she okay now?
She's going for a biopsy on Thursday.
But she lived when she first got it, her first round, right?
Yes.
Praise God for that. Okay. Another risk factor, like she said, is when you actually start your menstrual cycle. So some women who start their menstrual cycle, I know this is TMI for some of the men, but if you ever had a daughter, you know, they start their menstrual cycle very young. This means that they have a lot of hormones that are growing super fast in their body. So women that start their menstrual cycle at 8 and 7, not that they can't help that or of any kind, but it is a risk factor for breast cancer.
Like I did mention, weight, that plays a big role, especially if you are overweight. You are at a higher risk for getting breast cancer because you have excess fat in certain places where you're not supposed to. So that's what puts you at risk for breast cancer. People are categorized into 2 categories, which is like apple-shaped and pear-shaped. And then we have a picture up here of what apple-shaped is.
I know you can barely see it.
I know. But apple-shaped just means when you have like most of your weight all over your body. So, and then pear-shaped.
On the top. Apple is when most of the weight is on top of your body. And then pear-shaped is...
Most of it is on the bottom. That's why it would be like pear, because most of the weight is on the hips, and you have a skinnier waist, a skinnier top. So that's what it is.
Also, another risk factor that we can actually help ourselves would be alcohol intake. They say women who do have 1 drink a day, they do have a higher risk for alcohol, although some wines are known to help you with cardiovascular disease. So that is kind of an opposite there, but the alcohol does cause our hormones to kind of act up in our cells in our body. So, and it is a toxin. So, I mean, 1 drink a day does sound like a lot. I'm sure some people have 1 drink a week, or, you know, that's very good. You're not going to die. Still enjoy your life.
Okay, so what is breast cancer? Breast cancer is a type of cancer. It originates in the breast tissue, and it's most commonly in the inner lining of the milk duct. So we gotta remember, if our mom breastfed us, that's where it is, like where the milk is going to be brought down. So it's the milk duct. So you see right here, you start accumulating a little lump on the breast, and that's when the tumor starts forming, and it's called breast cancer.
Okay, and there are many types of breast cancer. There is non-invasive and invasive. Non-invasive is obviously when a tumor has not broken into anything but the place it was originated in. So it hasn't gone through a wall of an artery or hasn't gone through a wall of a tissue. The most popular places, like Lupe said, is a duct, and a duct is the tube that brings the milk from the mammary glands to the nipple. And then lobules are glands that make the breast milk. So These are the most common places for the carcinoma to develop the cancer, duct being the most popular. So, and this is just showing an adult female with breast cancer. These would be her lobules. It's placed in the back of her breast. And these would just start making a tumor.
And then a tumor could be malignant or non-malignant. So malignant is like really cancerous, and
that can spread.
Mm-hmm, and that's when it starts spreading. So what you want to do is make sure that you're going to the doctor, checking yourself just to be completely preventative care, so you won't get it. And if you do have it, that's how you can tell.
And we do have a couple tablets. They talked about nutrient-dense foods. We do have a couple packets from the actual American Cancer Society. They were nice enough to donate these to us. So we'll pass these out. And then you can look at it yourself, you know, and you can give one to your mom if you want. I know everybody loves their mom. Who wouldn't, right? Here you go.
Okay, so for those that are lucky enough not to have breast cancer now, we always have to take preventative care, and this is through our diet, the way that we eat. Me and Mara are nutritionists, and we are studying to be dietitians. So,
and we do have another nutrition major in the room, Dolores here. She goes to school with us, so if we are saying anything wrong, don't feel bad to correct us.
So we want to take you to have a closer look as to what we study and just bring that information to everyone here. So with the food that you eat, just continuing on with the risk factors, age does play a major factor. As people age, the hormones change, and you start getting a higher chance for breast cancer. The reason why we mention hormones is because of menopause, and then after menopause, the women start having a decrease in their estrogen levels, and so that's when they have a higher chance for breast cancer.
Because basically your body has been one way your whole life, imagine this, and then your hormones just change, and your body kind of goes through a shock. So you want to make that shock as smooth as possible. That's why people get, I'm not going to compare this to cars, but just you want to make shocks smooth. And the way you do that is by eating healthy. So flavonoids. Flavonoids are found in lots of whole grains, lots of green vegetables like pea pods, things like this. And these carry lots of antioxidants. And antioxidants attack the free radicals in our body. And free radicals in our body are things that are going after our cells to destroy them. And some free radicals don't only destroy them, but they change the cells and cause them to become very cancerous or malignant. They just turn the body against itself, basically.
Flavonoids are most commonly seen in soy milk or soy products. So we do recommend that you do drink soy milk or start taking your little load on your soy products. So this could be from having tofu or something like that. Just because what it starts doing is that it starts acting like estrogen inside the body. So for the women, I don't recommend it so much for the men because you're going to have high increase in estrogen. I mean, if you want to, go ahead. But mostly for the women, just because you start losing all that estrogen, so you're preparing your body for the estrogen that you're going to lose later on.
Okay, so antioxidants. I already talked about these. These protect your body from the free radicals. Does anybody know where we can find antioxidants?
Blueberries.
Dolores can talk after everybody else who wants to answer.
Blueberries.
Blueberries are very high in antioxidants, and they're good for our blood flow as well.
Tomatoes.
Tomatoes are very high in antioxidants, and they are also high in lycopene. Is it lycopene or lycopene? Lycopene. And this actually attacks free radicals, and that is a phytochemical, which you don't have to get into the difference, but they're very similar.
Also good for prostate cancer.
Also great for prostate. Okay. Dolores just told us that lycopene does prevent prostate cancer, so I'm sure it does. It attacks those free radicals down there too.
So I mean, we could get in our blueberry shake in the morning, or our berry shake, or whatever it is. Just try to get your berries in, so you could get your antioxidants.
Okay, anthocyanin. This is found in the berries, the blueberries, like you said. I know Paloma, she just made a delicious berry shake, and it had blackberries, blueberries, raspberries. And the darker the color, the better it is for you. I know they say the darker the berry, the sweeter the juice. But hey, this isn't true here. Sweeter in both ways.
And the reason for this is because it helps protect against inflammation, and it helps protect against tumors that are growing. So less chance of getting those tumors.
Sulfites, I love garlic and onions so much. Like these are found in garlic and onions, and they just strengthen the immune system, period. And everything that we are describing to you right now, you guys, is an antioxidant. So someone asks you next time, what is an antioxidant? Sulfites, anthocyanin.
So yeah, get your dose of garlic or anything like that. Anything that's white has that in there, and then you'll protect yourself against that. Now that it's cold, go ahead and drink that. It will protect your immune system, so don't be scared to do that.
Okay.
There is a mammogram that you can do in order just for you to check if you do have the breast cancer.
And it is recommended.
It is recommended for women, usually over the age of 40. Go ahead and do it once a year. But I mean, we're all young here, and we're not 40. But that doesn't mean that we can't feel ourselves, right? In the shower or wherever it is. You could go ahead and test yourself out. You don't have to go and take that test just yet. So,
and here, while she's talking about this, I will be passing out another American Cancer Society pamphlet about how to check your breasts. I know this is going to be awkward to give to your mom, but
yeah, don't be afraid to give it to her. I mean,
you may say
those that are informed are the ones that are going to know and protect themselves in the future, right? Mm-hmm. So the things that we do recommend on how to do like a self-test is just to lay down. You could be on your back, and then you could just touch yourself on your side most likely, and then feel if you have a bump. If you have a bump, that is a big alert warning, so go ahead and go to the doctor after that. If your breasts are very hard, or if they get to be very tender at the touch, if they're itchy or scaly, put cream on them. But also make sure that you check that it is a big risk factor. And if your nipple starts getting like a discharge or something, you know that it is a big risk factor.
Another thing just to add is the best time to check your breasts are right after your period stops, because right before our period starts, we're gouging, we're just retaining more salt in our body, we're just going to feel a little bit bigger. We're also going to have more chance for cysts, but right after that, you're kind of going to be cleared of all that extra water and all that. So just check afterwards.
And then the procedure itself, what they do is they have this machine, and they just compress all the tissue down, and then since it's compressed down, then that's when they check for tumors. And so the woman does have to put her breast in these two, they're like big metal plates, and they just squish it down. So it is a little bit uncomfortable, but it could save your life. So we do recommend that you do, for those that are older than 40 or at 40, go ahead and have that procedure done. Or in case you have a warning sign saying that you do have a tumor, don't be afraid to go get it done.
All right, so we do have a couple questions, and then we'll be done. We'll be out of your hair then. I know Lupe is going to do a myths and facts. Of course, I'll do a little quiz for everyone. We did want to talk about, right before we do this quiz, does anybody know how much physical activity, or this is going to be part of the quiz because we're all grown in here. Does anybody know how much physical activity we're supposed to have a day? Or per week, or per day? At least.
30 minutes a day?
Heart health. Yes, 30 minutes a day. So what would be an example of an anaerobic? I know a lot of us are science majors. I know some aren't. But what anaerobic means without oxygen. So what would be an example of an anaerobic exercise? Does anybody know? Would it be yoga? Would it be
Cardio.
walk for 5 miles, or would it be a 150-meter sprint?
Yoga.
Somebody gonna help me?
Yoga?
No, it wouldn't be yoga. Anaerobic without oxygen. Namaste. I'm taking deep breaths. Mile
The
walk.
50-minute,
Huh?
the sprint you said?
The 150-meter sprint. Because I would be able to breathe that much because I'd be running so hard. Okay. What would be the most effective method for weight loss? Would you increase your workout to 7 hours of vigorous activity per week? Would you decrease your calorie intake by 800 calories per day until your weight goal is reached? Or would you aim for a nutrient-balanced diet and work out 4 to 5 times a week for 45 minutes a day? Or would you restrict yourself to only proteins and then work out 4 to 5 times a week? But how would you answer that? I know it's a little difficult.
We never want to just restrict ourselves, right, to something that's so hard, especially if we're just starting out. So like she said, having a good exercise plan and having your good balanced diet. So that's what it is. So.
And then one more true or false question. Regular physical activity is only useful for weight loss and preventative cares for cancer. Is this true or false? About physical activity.
False.
Yes, because it can also help heart disease, diabetes, so many things.
Okay, so now we're going to do a myth and fact game. So just yell out myth or yell out fact after I say the statement. So if I find a lump in my breast, I have breast cancer.
False. Myth.
Maybe we should change it to true or false.
Yeah, we could do true or false. I guess that's better. Yes, that is a myth or it is false. Just because I find a bump doesn't mean I have one. Actually, 80% of the lumps in women's breasts don't turn out to be cancerous or an indication of breast cancer, but go ahead and check. Only women with a family history of breast cancer are at risk.
Myth. False.
Yes, that is also a false answer. 70% of women diagnosed with breast cancer had no risk factors, nothing in their family. So just because your great-great-great-grandmother didn't have it doesn't mean that you're not going to have it either. So I am too young to get breast cancer.
Myth.
Yeah. Just because you're not 40 or you're older does not mean that you're going to get breast cancer. There are women, unfortunately, that could get them at the age of 19 or even younger than that. Just because you're not old doesn't mean you don't have to check yourself. Like what we said, go ahead and just give yourself a feel here and there. Just check. It's called a self-assessment for a reason, so don't be afraid to do it. So wearing a bra with an underwire means that you're going to have breast cancer. Yeah, guys, it's a myth. Underwire is not going to give you breast cancer. So men cannot get breast cancer. For the men inside this room who feel like, why am I here? I'm not going to get breast cancer. You have a big chance of getting breast cancer. Actually, there is 1,700 men a year that are diagnosed with breast cancer and over 500 die yearly. So, I mean, we're not saying that you're going to get it, but now you know how to protect yourselves. And a mammogram could cause breast cancer to spread. Since they are squishing down all that tissue, do you think that it's going to cause it to spread? Yeah, that's also a myth, guys. Just because you're getting a mammogram does not mean it's going to spread. So go ahead and feel free to have that test done. And that's the end of our presentation.
Thank you.